When it comes to caregiving, lived experience can be one of the greatest teachers. In this episode, we're joined by Amy Goyer, a nationally recognized caregiving expert, author, and family caregiver who serves as a caregiving expert with AARP, and Beth Pinsker, an award-winning financial journalist who has written extensively about the financial realities of caregiving. Together, they share personal stories, lessons learned along the way, and practical insights on navigating the emotional and financial challenges that so many caregivers face. Welcome back to the Care Economy, where we're making sense of the economics of family caregiving one conversation at a time. I'm your host, Maureen Feldman, and today's episode is powerful. We're joined by two extraordinary women who bring both professional expertise and a deeply personal experience. Their stories are honest and vulnerable, and most importantly, they're full of lessons for caregivers and the professionals who support them. First, we have Beth Pinsker. Beth is a certified financial planner, a Market Watch columnist, and the author of the acclaimed book, My Mother's Money, A Guide to Financial Caregiving. Her book explores the financial complexities and emotional layers that caregiving can uncover, even for those who are steeped already in financial knowledge. And then Amy Goyer. Amy's a national recognized family and caregiving expert who's worked in the field of aging for more than 40 years at the local, state, and national levels. She's widely known for her work with AARP, where she serves as the organization's national family and caregiving expert. And what makes Amy's voice especially powerful is that she's been a family caregiver throughout her entire adult life. And she's written about her journey, including filing for bankruptcy due to caregiving responsibilities in her book, Juggling Life, Work, and Caregiving. There, she blends practical guidance with personal storytelling to help caregivers navigate the complex challenges of balancing work, life, and the caregiving role. So Beth and Amy, I really appreciate you both agreeing to join us for this conversation and to talk about the financial challenges that you both faced and tackled, and to let our listeners learn from what you've gone through. So thank you for being here. Welcome.
Thank you.
Glad to be here.
I have a lot of questions for you, both professionally and personally, but why don't we just dive into the numbers right away? I think that's what everyone is interested. This is a podcast about financial well-being of family caregiving. So my question is, caregiving can cost families thousands of dollars in lost income, out-of-pocket expenses. So I'd love for you each to share with us the first moment that you realized this role was going to hit your finances much harder than maybe you expected. Why don't we start with you, Beth?
I found out the hard way about 3 weeks into my mom's illness. She'd had surgery, and we thought she would be back to normal pretty fast. And instead, she had a few complications. And so when I sat down to pay her first set of bills at the end of the month, I found that she had a premium for her long-term care insurance that was overdue. Needed to be FedExed immediately to the long-term care insurance company, which was really important to us because that was the only money we had coming in to cover her care. And it was almost $7,000. And I had not put in the paperwork to be her power of attorney yet. I had it in my hands, but I hadn't taken it to the bank. So I couldn't write a big check from her account because I figured that they would catch. So I had to write it from my own account and FedEx it off. And that was a big wake-up call that this was going to be a very complex experience for me and my family.
Yeah, I would think that would be a shock. That's a lot of money, $7,000. How
I
about
don't need that kind of money laying around.
as most of us, I don't think do. Amy, how about for you?
I think that's really hard for me to pin down, Maureen, because it was a gradual a thing that grew over time for me. And I, as you mentioned, I've been a caregiver my entire adult life, but the most intense part of it was caring for both my parents and my sister. And things kind of blew up when mom was hospitalized. Dad had developed dementia and was clearly starting to really struggle with keeping up with things with my mom's care. And it was just clear that we wanted him to stop driving. A lot of things came together, and I knew I needed to move from Washington, D.C. out to Arizona to help take care of them. And so there were multiple points over the next decade that, were struggle points for me. I think the first impact was that I quit my job and became a consultant to be able to have the flexibility to do this. And I lost benefits. So I lost my health insurance. I was no longer contributing to a pension, all of those things. And then I had to pay my own health insurance. And that was a shock to me, how much that cost. And, just trying to get a handle on my parents' expenses. Like Beth, I discovered debt. I discovered things that, my dad had Alzheimer's. And even though he had been managing day to day really well, making some of those bigger decisions, probably he didn't make some of the greatest ones. And they had used most of their retirement savings by the time I got involved with their finances. So that was a big shocker. And trying to figure that out and trying to be responsible about helping get them out of debt. Of course, by doing that, then I ended up getting myself into debt. So, all of those things, I think a lot of times caregivers, we take on expenses that we don't think about, like traveling. I had to keep a place in the DC area to go back and forth for work, trying to figure out the budget and trying to make everything work. And, all of that it was one shock after another.
That's what it sounds like. Where Beth had one moment where she realized, wow, this is way more than I expected. Yours seemed to be very compounded. And not only were they your parents' finances, but obviously and clearly your financial choices or the choices you made impacted you financially from changing jobs and healthcare. Well, we want to come back to that. I definitely want to come back to that. And I know we will in the next few minutes. But Beth, when financial knowledge wasn't enough, you are a financial professional. You understand planning and risk, yet caregiving brought challenges you didn't fully anticipate. In your book, My Mother's Money, you write honestly about managing someone else's financing, not just the numbers, but the emotional weight that comes with that responsibility, which Amy is kind of laid the groundwork for this conversation. If there was one financial mistake families most often make when they step into this role, not because they're careless or because they don't know but better, what is that?
I would say that the biggest mistake most families make is that they don't assess the time frame correctly. They make decisions too fast sometimes and too slow other times. When you're planning for retirement, like you're planning for, a 30 plus year timeline, and you make certain decisions based on the fact that that is a long-term growth situation. When you're dealing with an illness, that time frame gets shorter, but you don't know exactly how long. Like if we all knew when we were going to die and when all our loved ones were going to die, you could pace out the exact amount you should spend per month and how to stretch out, the amount to see how much you would need. But when you don't know the answers to those questions, it becomes difficult. But when somebody's sick, it necessarily is shorter than the 30 years. So it's hard for families to face that reality, and they don't know whether it's 2 months or 12 years. Dementia takes a long time sometimes. We thought my mom had, another 20 years in her. She had a spinal problem that she was trying to correct. It wasn't a terminal illness of any kind. And we thought she had years and years and years, and she had about 9 months. So you just never know.
You don't know. And what Amy is talking about also, you don't know. It sounds like you were caring for one person and then other issues with your parent started to arise. And then you mentioned a sibling too. So Beth described financial blind spots that surprised even a certified financial planner. Did you experience similar risks, or were those financial pressures different than what Beth described or what you had described earlier that came up for you?
I think one of the things that we don't realize, and AARP's research has shown the costs of caregiving, and family caregivers spend on average 26% of our income, which is $7,000 a year on average, but I spent way more than that. And it's also what we spend the money on. Like I took on more household expenses. So we're not just talking about the medical care aspect of this. I ended up keeping up 2 homes by doing this, taking on my parents' mortgage. They moved into a senior community for a few years, and then they moved back in with me. So then I was paying for their home, their food, their clothing. Their income went entirely to paying caregivers while I worked, and some of their medical expenses, and I picked up everything else. So, 52% of family caregivers are spending money on household expenses. We're not just talking about medical things. Medical expenses is 17%. So it's a big difference, and then all the supplies. So for example, a big expense is incontinence supplies, very expensive. And, all of the other things that go along. And by the way, part of our responsibility is quality of life. So trying to have some entertainment or going out to dinner now and then or anything like that, just basic life things. We're not talking about, extreme spending. It's just the day-to-day things add up. So I think those are things I didn't think about, again, going back to just becoming a consultant I had to pay much more in taxes than I anticipated, healthcare expenses, I think the biggest surprise for many caregivers and for me was the cost of the paid caregivers. I wanted to keep working. I had to keep working, but my parents got to a point where they couldn't be alone. And then travel expenses. My sister lived in Maryland, and my parents were in Phoenix area. And, I had the place in DC that was less expensive for me to keep that place than to stay in a hotel. And I had to go back almost every month for work. Then my sister, and when she passed away, then I had the expenses of keeping up her house while I emptied it out, tried to sell it while still taking care of my mom had passed away too, taking care of my dad. I think those are all the things. And then just the long haul of dementia. I think, like you say, that sometimes something else intervenes and a person with dementia doesn't live as long. But Dad was 94 when he died. And it was many, many, many years of mounting expenses.
Amy, first of all, what you're describing is just incomprehensible for most people, to be caring for both of your parents and then having your sister. And I'm sure any sibling who loves their sibling would do the same. I can't imagine managing that and making emotional, financial, and medical decisions for your parents or someone else. So first of all, my heart, and I'm sure many others, go out to you for this. And you've been very open about the fact that all of these compounded financial pressures eventually ultimately led you to bankruptcy. So thank you for sharing that so openly, because you're really destigmatizing some of this. This is nothing that you did wrong. But what do you wish or what do you wish had intervened sooner to change that outcome? And when I say what do you wish, is that policy? Is that a decision you could have made? Is that employers? You mentioned having to go to become a consultant. So clearly there were a lot of decisions you had to make. Can you walk us through that just a little bit?
There are so many things. There's no simple answer to this, obviously.
Right.
And when I think about it in terms of how did I end up in that place, it was taking on the extra expenses for so many different people and other family members as well, by the way. Then having, again, those caregiving expenses that are not medical expenses, the travel, all of those other things on top of it. I think some of the things that would have helped. One, I wish I'd had a financial advisor for me. My parents had a financial advisor. I was trying so hard to be very responsible with their money, get them out of debt and do everything right with their money. And I just took it on myself, thinking I have time. I can take care of this. At the time, I made the most money of any of my siblings or my parents. So I figured, this is my responsibility. And that kind of thinking was not completely realistic. And I just kept thinking, I should be able to manage this. I'm a smart individual. I know a lot. I can do this. And I wish I'd had someone saying, okay, no, let's not do this. Let's do this, The other thing is, as you say, employer policies. When I came out to take care of my parents, it was 2008, 2009. And things were different then. There's much more flexibility in the workplace now. Even those years I was caregiving, it was important to go into the office for meetings on a regular basis. And now you can do almost everything remotely and people aren't as worked up about it, you know. So a lot of things, you know, if I could continue to work with an employer, it would have made a difference with my pension and my health insurance wouldn't have cost so much and all of those things. So that's something. And then the other thing is that my dad was a veteran and I did not apply for veterans benefits for him until 2012, I think it was. And then my parents moved back in with me. It took a year to get those benefits going. And then initially that was aid and attendance. And then my mom died and we lost her income. So it kind of just made up for what mom's income. So I wish I had done that sooner. And the reason I didn't do so was because my parents still owned a property in Ohio. We had a farm there. And it was difficult because my sister was living there. And for me to be the one in charge and say, we have to sell this property, it's a financial drain for my parents, was really, really difficult. Plus the emotional aspects of this property that had been in our family for so long. So I wish, though, that I'd done that sooner.
Yeah, you had so many areas from personal and sibling dynamic and family financial. But you brought up something that I would like to highlight, and that is you mentioned you wished you had sought a financial certified planner for yourself, which, you know, I think most caregivers are not thinking about how to care for themselves or where do I fit into this or my long-term mental, physical, or financial health. I really appreciate that you brought that up. And also, you had talked about flexibility with your employers. And we have an episode that focuses on work life HR benefits where they highlight what employers can do. So I appreciate that you brought that up as well. And I'm guessing it would have made your life a little easier. Maybe you wouldn't have had to quit your job and lose your medical benefits because of that. Let's shift to you, Beth. I mean, would you like to answer that question as well? I'd love to hear from your point of view as a financial planner.
I would like to answer for Amy. I think that one thing that families do is they jump in and they don't look first at what is covered by another source. One of my chapters, I talk about, you know, the first thing you want to do is figure out what's paid for by somebody else, by insurance policy, by government safety net, by Medicaid, you know, those kind of programs. And you gotta, you know, the VA is an important one. I had a family member also who did not apply for his VA benefits ever. He thought about it as charities. Like, I don't need to do that. But he had actually served during wartime and deserved them. And so when he finally, you know, we got him there just in time to sign up before he started to get sick. And he now, you know, gets a stipend and has a home aide that comes to the house, and it's saving his wife the hands-on caregiving and also is adding to the monthly household income, which was getting very tight for them. And so people need to look at whatever they are due for and whatever resources are at their disposal. And family resources are not necessarily on the table. As an adult child, you have no obligation to pay for the care of your parents. You might want to, and you might be able to, and so you go ahead and do it, but you don't have a legal obligation in the same way that they had to you when you were a baby and they had to take care of you. So if you cannot pay for it, and if you cannot afford it out of your own pocket, that's when you turn to the federal safety nets that are out there. That's when you turn to insurance products, because you don't have to if you don't want to. And there are places that can help your parents and help pay for some of those costs. They're not easy. There might not be the care that you want for your parents. The Medicaid nursing home in your area that your parent can get into might not be the standard you want. You might not want them in a nursing home at all. You might want them at home. And Medicaid assistance at home is harder to come by than at a nursing home. So you have to sort of balance all of these things. But their debt and their care is not your legal responsibility as an adult child. And, you know, but when you're in a loving family, like I didn't go into my mom's care situation thinking, you know, I will help her, but I won't put a dime of my own money on the table. My mom paid for her parents to have care. I would have paid any amount of money that my mom needed that I could handle. But the first thing we did was turn to her Medicare coverage. My mom had a qualifying hospital stay, and she went then into rehab. So what we did was try to draw out and use Medicare for the hospital stay for as much as we could. Like we tried first to maximize the amount of Medicare coverage she got. Then when she went into rehab, rehab covers a certain amount of days in rehab. It's not long-term care. It is not a long-term solution at all. It is not at all what Medicare covers, which people do think that like, oh, Medicare will take care of me when I'm old. The answer to that question is universally no right now. It might change in the future, but for now, no. Medicare covers you for a very short amount of time for an acute illness. So my mom went into a rehab facility and she was, eligible for up to 100 days of care. And so it was my job as her financial caregiver to try to get every last day that we possibly could, because it's not like Medicare says you can have 100 days and you get 100 days. You get only what the doctor says you get. So they kept trying to kick her out. As soon as you have a loved one that enters a care facility in that capacity, the first thing they're going to do is talk to you about how they're going home and when they're going home and what you're doing next. And so my job as a financial caregiver was to maximize the amount of Medicare coverage she could avail herself of. And then it was, okay, when we got to the end of that, what are we going to do next? And our choices all were very, very expensive. Staying where she would have cost $12,000 a month. Going home would have cost at least $3,000 a month for the caregivers, probably more like five, but it wasn't like the safest move. She ended up going home on hospice, which, sounds like an emotional, or medical choice to make based on your values and end of life decisions. But really, it was somewhat of a financial choice because Medicare, again, then comes in and picks up the cost of hospice. Doesn't pay for the home, it doesn't pay for extra care, but it pays for the nurses to come and the medicine and the infrastructure involved. And so we chose that route because we were availing ourselves of every possible, public fund source to help her pay for her care.
This is really interesting because of what Amy described. And obviously, you had your sister and both parents, and then you, Beth. What you're saying is look out for yourself, both financially and emotionally, and to immediately, that first step is to learn what resources are out there that are available not only to the person you're caring for, if that's a spouse or parents or sibling, but possibly resources for you. Maybe there are some pro bono legal workshops you can take. And I've heard about some of our fabulous AAAs, the professionals, those are our area agencies on aging, are putting together financial workshops for family caregivers to not just teach you how to better care for your loved one, but how to protect yourself as well. And that, I think, is a really important first step. And I thank you both for sharing those details. And so I do want to stay on the financial impacts here, but I'm also curious about something else, which is when the financial pressure kept mounting for both of you, Amy and you, Beth, what did it start to cost you beyond dollars? So in your work, your relationships, and even how you saw yourself. Did either of you feel the pressure to just keep going financially, professionally, personally, even when your own financial stability was clearly at risk? That's what we're talking about here, is how do we protect our family caregivers and the people that are out there doing what any loved one would do, but how do we protect those people?
My mantra was, it's a lot. It was a lot. It was a lot of back and forth. My mom was in Florida and I was in New York. It was a lot of juggle. It was, I have two teenage children. I'm a divorced person. So it was, when they're with me, it's just me. And, I was juggling my schedule, my brother's schedule, my mom's schedule, doctor's appointments. everything that a adult human being has to juggle. And it was a lot. And there was a time towards the end where I had to walk into my boss's office and say, I just got a phone call. I'm going to Florida on the first flight and I'm leaving and I don't know when I'm coming back. And, when you take that into the workplace, you don't know in America what you're going to get back from that. I didn't want to step away from my job. My job was flexible, but I had too much going on. I had just been through 9 months of trying to juggle it all. That was the moment where I said, I can't juggle this anymore. I need to be present for what's happening in Florida. This is probably it. And I just need to be there for it. And luckily, I work for a very humane organization and the boss that I was talking to had just gone through this with a parent and said, I completely understand where you are. Tell us what you need. How can we help?
Oh,
We hope everything goes well and we will be there for you all along and, when you come back.
wow. I hope employers listening that are able to support their employees this way recognize this trend that's happening. And how about you, Amy?
I 100% felt the need to just keep going. And I felt the pressure was on me. It was up to me and me alone to figure it all out and keep all the balls in the air. And I had help and support from my sisters. My one sister, eventually, I would fly her in to help take care of my parents. That was my expense. Eventually, she moved and helped, but it was ultimately my responsibility. And that stress affected my health. I mean, it was constant financial stress for many, many years. We're not talking 2 years here or 4 years. We're talking a decade. And that made me feel like I constantly was a failure because I was never quite getting on top of it. And it'd get better and then there'd be some catastrophe with the house or there'd be some big expense or a hospitalization or whatever. And, a change in dad's needs for care. And then it would get worse again. And I was constantly working on spreadsheets and trying to figure out how to deal with the raising credit card debt. I mean, keep in mind that for me, what I did was what I didn't have the immediate finances to pay for, I used my credit cards. And then that interest rate jumped up to 29, 30%. You're never going to dig out of that. And then I'm trying not to create more debt every month. So I'm using funds I had to pay for things instead of credit cards. But then that interest rate's still going up. So if I can only afford to pay the minimums, which everyone knows is a bad idea, I know that, but that's what I could do. And then you're going against your knowledge, but you're doing the best you can, and I just really had to work at adjusting my view of success and not always seeing myself as a failure because that wasn't helping me or my parents and no one in my family. So it's just trying to do my best. And I think that's what caregivers have to grab onto is there's no perfect answer to any of this. Not everyone qualifies for Medicaid or other benefits. Not everyone is a veteran. Sometimes there are no other options. So you just have to keep doing your best and avail yourself of the resources that are available to you. Like Beth, I look at it as a big puzzle. Like, okay, maybe I get this many hours of respite care. And maybe the VA covers this much. And, Dad had long-term care insurance that helped. It's all of those things together.
Amy, you bring up so many points there, and I saw Beth shaking her head. And as caregivers, we're doing the best we can. I learned from the dozens of people I work with, you don't often have time to plot out a plan and make these decisions with a lot of input. You have to make a decision, whatever your family member needs. So I do like the idea that you're talking about that caregivers are doing the best they can. And many of our caregivers don't have access to all the resources. Maybe they were not a veteran or they don't qualify for Medicaid or they did not have a good insurance plan. So I think setting that reality check, but these are very hard choices that caregivers are making. And Amy, you talk about the financial issues compounding and interest rates building. So the pressures can really build. So, but I don't want to just look at all of this conversation as a set of cautionary tales. So I'd love to know that good decisions still exist, even in challenging systems. So you've both been pretty candid about what didn't work and what systems that might have failed to catch you. But looking back, what do you feel you did right in navigating the financial side of caregiving?
I think we did the big things right, and the big things are what matter. And the finances should always be the little details that get worked out. And by big things, I mean my mom knew that I loved her, and I knew that she loved me. And I knew what she wanted, I knew what she valued. We had had discussions about it, open, candid discussions about throughout her entire life. She was very clear about it. She didn't want to be kept alive in diminished circumstances. And that was very important to her. She wanted power and agency over her life. And she had spinal surgery because she wanted to walk and because she wanted to be independent, and that mattered to her. And so I knew all of these things. We were a close family. We loved each other. And I think Amy probably experienced that too because she was a hands on caregiver and she was doing those things because they are an expression of love. And this stuff is hard. This stuff is expensive and this stuff takes a lot of effort. And, you're not always going to do everything right, but we all do it. Like we're all going to end up at some point doing it. And God help us. I hope somebody does it for us too. But we do it because we love each other. I did it for my parents, and I hope my kids will do it for me. And this is how families are. This is what human beings do for each other because we have this great capacity to love each other. And no matter how hard it is, it doesn't matter at the end of the day because we're doing it out of love, not out of financial remuneration or anything,
So you're saying that when you say that you did certain things right, you're talking about the communication you had with your mother, that you understood how she felt about you, you shared your feelings with her, and that deep, purposeful connection was elevated.
Yeah. So whatever I had to do to pay her bills and manage her caregivers and deal with the Medicare administration and file the endless stupid paperwork from the long-term care insurance company and empty out her apartment and give away her jewelry and all of that stuff, it's all just details at the end of the day, and what matters is that I loved my mom.
Yeah. Thank you for sharing that, because we don't want to forget, upon all of the weight that we feel on our shoulders and the finances and the job changes and the cost, we don't want to forget what it's all about. Is these are family members we love dearly, and we would do this no matter what if we're able to. But this podcast is hopefully about slowing down or stopping that cycle of having to make these hard decisions. We don't want caregivers to go into poverty and then have no money for their own care because they cared for their parents, and then their children will have to stop working to care for their parents, and that cycle. So hopefully we'll be learning from this experiences and your shared experiences. So Amy, I see you probably have something to add to this. I'd love to hear it.
Like Beth, above all, my parents received the best possible care I could provide for them. And I did my best for my sister from a great distance, and she did have a good local support system. I wish I could have done more for her, but my parents, required more help. And it was, that was a very difficult emotional thing, being torn. But I know I did my best for all of them. I have no regrets in that regard. That's the top priority. And I was motivated by love. Not all caregivers are. I mean, many caregivers don't have a good relationship with those they're caring for. And I think we need to acknowledge that sometimes it's even harder because they're doing this to someone who is not nice to them or hasn't treated them well growing up or whatever. So I think that's really important to note. The things that I did right in terms of financially, I kept working, and that was a paramount thing. And I think many caregivers end up stopping working, and they stand to lose, over $300,000 or something of lifetime wages and benefits. I think that's a very outdated number, but it's a huge impact if you stop working to caregiving and then try to go back. The other thing is I didn't touch my 401k, and that was a good thing. And in the bankruptcy, that was not taken. I did manage my parents' money well. I did my best for them. I did do that for them the best that I could. And looking back, I should have been like, okay, let their debt go up instead of mine, because in the end, their debt went away. But the other thing I did well was I managed my own stress and self-care as well as possible. And so, I often look back and I second guess myself. What decisions could I have made differently? What could I have done? Should I have not gotten that massage? Should I not have done Pilates once a week with my instructor that truly saved my back and my body, my strength, because the physical aspects of caregiving, but was also a great stress reducer. And don't think in any way I was extravagant. My best friend and my boyfriend made sure I got a break once a year, because my best friend had a timeshare and she'd take me to the beach or whatever. I didn't pay for that. I may have paid for some things, but you have to survive this experience. And when you're in the long haul, like I was for many, many years, you try to figure that out. So, I look back and I think I did the right amount of taking care of myself so I could get through this and not completely lose my mind, and balanced with a few good other decisions. I wish I would have still tried to contribute $100 a month or something to my 401k. I didn't do any of that, but I did the best I could with the information that I had at the time.
For caregivers that are listening or just starting in this journey, or maybe AAAs or professionals who are supporting family caregivers who haven't had this experience themselves yet, just listening to you questioning, should I have taken Pilates, which is, helping my back? And, it's hard to comprehend what making a choice like that is. And when you're talking about going into debt, you mentioned something, and I want Beth's input on that, because you said something really important, which was maybe you should have let your parents go into debt instead of yourself. And that, I see Beth shaking her hand. Do you want to make a comment there? Because I think you should.
Yeah. So, one thing that people tend to miss is that when you die, your debt is not inheritable for consumer debt, for credit card debt. The creditor will take the money from the estate if there's money in the estate. If you're in a situation where your parents have spent down all their assets and all they have left is debt, it sort of dies with them. So if it's a choice between paying for something for your parents on your credit card or their credit card, and it's truly for them, then I would say put it on their credit card. I tried to do that as much as possible with my mom. In my book, I tell the story of a Hollywood television producer whose mom died with $70,000 in credit card debt. And he called the company and offered to pay it. And they were like, what are you talking about? We just write that off. And he actually wrote that into the episode of a television show. He worked for the Connors, and one of the characters in the Connors has Alzheimer's. And he wrote that into her character's story arc, that, the family was sort of negotiating what to do about this credit card situation. And then when they found out that the debt wasn't theirs to inherit, they started to charge up her credit card, which is actually fraud. And you can't do that. So it has to
And
be.
we're not advocating that. We're definitely not advocating that
So
here.
there are rules to it. Like, not everything on a credit card gets wiped out. They will come to the estate for it. If there's money left in the estate, they will take that money. So that money will not go to your inheritance. But it's not your debt to inherit on a credit card. Also, this impacts Medicaid eligibility. I think for Amy, any money you were putting into the household would have delayed a Medicaid qualification for either of your parents.
Right. But my dad was getting veterans benefits, so he would never have qualified for Medicaid.
Okay.
And they had a decent retirement income. They wouldn't have qualified. And they would have, we would have had to, it's complicated with Medicaid, and we won't go into the details of Medicaid. I'm sure you have a guest who's going to talk about Medicaid, but it would not have been an issue for them.
So, right. So not every circumstance is the same, but so if you have a parent who could eventually qualify for Medicaid and you keep giving them money, which counts as a gift, you delay them from qualifying for Medicaid. So this is where consulting with a professional, consulting with a financial planner, consulting with an estate lawyer who's well versed in Medicaid applications and Medicaid qualifications, this is where you sometimes need some help because the rules are complicated. Sometimes you don't know what you're doing. Sometimes you had a sister who was disabled or sick. A lot of people have siblings that they end up taking care of after their parents are gone. There are complicated rules for money that you can give to those individuals who have Medicaid benefits and how you give them money. You could be as well-meaning as possible and end up messing up their Medicaid benefits just by giving them a birthday gift of some kind.
Things like I had to travel to check on my sister and do things for her. That's not covered by Medicaid, and that's not affecting her Medicaid either. And she was on Medicaid, but so I didn't take on as much of her day-to-day expenses, in that respect. But then when she died, it was all on me, and the house sold for less than it was owed. So I never got any of that back. And, so there are so many layers to our caregiving stories. I think that's the thing. There's no one, well, if you do this, then X, Y, Z. But you need to know that, okay, if you do this doesn't work, then try this, then try this. There's layers of it.
I would love to ask you both because not everyone listening has a home. They don't necessarily have assets. They don't have 401ks and they don't have savings. Some might not even have access to credit. And we're talking about family caregivers that, like you said, they might have started taking care of grandparents or their parents. So for the family caregivers listening and for the professionals who support them, is there a concrete financial step that maybe you would have taken earlier that would have reduced your debt or protected your income or prevented long-term damage, or that you would recommend they look into? Because I want to make sure that those people that might not have employers or employer benefits or assets have some concrete steps, and the professionals who are supporting them have some resources they might be able to get together to help support those individuals. Any advice there?
The first thing I always tell people is contact your area agency on aging.
Yes.
And find out what, like you mentioned, workshops. Do they have, financial planning for aging? Do they have caregiving workshops? Do they have any kind of educational opportunities? So you really start to understand, especially Medicaid planning, any of those things. Contact a certified Medicaid planner. The CMP board has a search tool, or an elder law attorney. Again, the area agency on aging can often help you navigate to that. Sometimes they have case managers and programs that can help you figure that all out. So that's always the first thing. But then, like I said, a financial planner, that's for your loved ones. That's planning their finances, their care. You still need to look at yourself and your own financial planning, because you don't always know when caregiving is going to hit you. And you may know it's going to hit you eventually. If you have parents you plan on taking care of, or a spouse or whoever, then you need to start thinking about that sooner rather than later. And I talk with more and more younger people who are more aware of this. They see their parents caring for their grandparents. And I think that's a good news thing. I think reaching out to younger and younger generations who are, by the way, caregiving, but also maybe preparing for caregiving is helpful to think ahead of that, so that they know how to navigate. What is long-term care insurance? What are the differences in the policies? What are the veterans benefits? How can I help pay for the heating and cooling bill at my grandmother's house? Maybe she qualifies for some assistance,
I'm glad you brought that up, Amy, because we are going to do an episode on the trends for younger individuals are more and more becoming caregivers. And we're talking about not just millennials, but the Gen Zs and Ys, and that caregiving is not just for the young boomers or the older millennials. So I'm glad you highlighted that this is a trend that is sweeping not just across America, it's global. And this conversation is not for a small sliver of our country. It is impacting individuals of every income level, every socioeconomic situation. And Caregiving doesn't discriminate, right? Beth, did you have some advice for those caregivers that we're talking about that don't have access to those resources?
Even if you have a negative net worth and negative balance, you need somebody who you trust to take care of things for you after you die. Because the way I phrase it is, we're all connected to the grid of civil society in some way. We all have people we love. We all have connections somehow. You either have a power bill or a negative balance on your credit card or a bank account. It's hard to walk through life in America without being connected. Even just having Medicare and Medicaid and Social Security, you have a connection to the grid. And when you go, somebody has to turn out the lights and shut the door on the way behind you. And that is a financial responsibility. They have to file your last tax return. They have to close out any accounts that you have. They have to turn off your newspaper delivery and, whatever else you have. They have to manage your, the closing down of your social media accounts and your cell phone. And, even people who think they have nothing have all of those things. And so you need somebody on your side. You have to develop a community. They call it the community of care. You need a community of care around yourself in order to take care of those tasks for you after you go. You can't just leave this earth and leave it to the next people to take care of.
Are you saying that the individual that is the older one that is being cared for should get those things in order?
Yeah, we all need to do that. At every point in our life, because you never know what's going to happen and what's coming around the corner. I mean, I woke up to this fact when years ago, I was walking home on a day that's very icy. It happens to be that way outside right now. And I was like, what happens to me if I slip and hit my head on the ice?
Yeah.
What would my kids do? What would happen to everything? And I couldn't sleep. I literally was like, oh my God, this is my moment. I have to take care of things. And I made some phone calls and got some peace of mind.
I like that. That's one concrete step that we can do. We can get digital executors for our social media. We can take care of some of that. But do you have any advice for the caregivers who are not supported by employers? They don't have assets. Maybe, they don't own homes. Is there one thing a piece of advice that you would give them, a first step, so that they don't end up taking on a lot of personal debt or filing for bankruptcy because they were not taking care of themselves financially?
I need to talk to a social worker and get every available social resource directed their way.
Good.
Lots of people enter this system, the caregiving system in America, when their loved one has a hospitalization of some kind.
Yeah.
And so the hospital has social workers. They will, you are automatically assigned somebody who will come and ask you immediately almost, what's going to happen to this person when they go home? Where are they going? Who's taking them home?
It usually starts with a crisis, yes?
Yeah, it usually starts with a crisis, or sometimes it's a diagnosis. Sometimes you're in a doctor's office.
I think honestly, I'm going to push back on that a little bit. I think for most people, it's a gradual increase in care. It's mom needs some help in the house. Mom's not eating, so I need to cook some meals. I need, dad had dementia. He did great for a long time, but he couldn't quite manage getting things organized for the taxes in the beginning. So I had to help with that. Now there's a lot of care that's gradual. And then sometimes, like you say, it is sudden. And sometimes it's an ongoing thing, and then there's a sudden increase. Mom falls and fractures her spine. I mean, that was 30, 40 days in the hospital with her. There are, so I just want to push back on the fact that for many, many caregivers, it is a gradual thing, and all of a sudden it creeps up on you. And then the next thing you know, oh my gosh, I have all this debt, or I can't pay mom and dad's bills, or whatever.
Amy, you're absolutely right, because you're describing most caregivers start out not identifying as a caregiver. I'm simply picking up medications for my mom, or as you said, I'm stopping by to cook a few meals, or I'm going to have a discussion with dad about not driving. So you're absolutely right. It is often gradual for many many individuals. So with that in mind, we have a lot of AAAs and social service employee programs listening. So drawing from your book, Juggling Life, Work, and Caregiving, what's the one financial trade-off that caregivers are making every day that employers and systems still fundamentally underestimate? And the reason why I'm asking that is because when there is that gradual increase, what ends up happening is what Beth said. I'm not showing up at work today, or I have to leave early to take my mother to the doctor's, or I have to leave and I don't know when I'm coming back if they're not in the same state. So, what's one financial trade off that they're making every day that you think employers and systems can contribute to make it better?
Many caregivers are paying for paid help so they can go to work. So employers may not be aware how much money they're paying for care in the home for their loved one so that they can come to work every day. And could that expense go down if they could work from home certain days a week, or if they could have more flexibility in their hours, that where maybe, they need to help get mom out of bed in the morning, but their sister can help mom get into bed at night, but so can they work the night shift. They're flexibility, things like that employers may not be thinking about, and that's a financial thing. The other thing is they don't realize, as we've talked about, getting help from an attorney, getting help from a financial advisor. Those things are not free. And even, legal aid mostly won't do this kind of work. So if employers can offer legal discounts, even just help making sure your loved one has a will set up, but also this Medicaid planning issue, and what are the long-term issues that you need to be thinking about legally, and financial advisors. If an employer offers discounted financial advisor services, well, maybe that's then something the employee can afford. So they need to look at what are caregiving employees doing, and how can we help with those benefits. And yeah, it's the support group and the employee resource group and the education and all those things, but there are some concrete things that you can offer that can help make it possible for them to spend less money and save, for their own future.
I'm really happy you brought that up, because on another episode, we had Diane Tai from the Milken Institute for the Future of Aging, and they had come out with a report in 2025 about best practices for workplace and employee benefits. And we also had Teresa McDade from Microsoft, and she was the head of the work-life, I think they call it balance benefits. It's the HR department, and they have a very progressive policies for family caregivers. And those are the things that they started right away, which was providing some support for their employees to understand the legal aspects of family caregiving, flexible hours, helping them understand what their rights were and how to access some of these resources. So what you're talking about is possible, and we hope that other employers pick up on that.
As well as paid family leave. I mean,
Yes,
we can't not mention that. I mean, that is a
paid family leave.
huge one. Increasing paid family leave across the country, whether it's a state mandate or employers offer that. That's a game changer for many, many employees.
Agreed. And I believe some employers are looking into that and recognizing that it was once about young childcare, and now it's turning into sometimes caring for a parent and or a spouse that needs our support. So with that in mind, I want to ask you, Beth, because you've both experienced caregiving from the inside of a system that rely really heavily on unpaid family care. So Beth, where do you think those systems are most consistently set up to cause financial harm to the family caregiver, and what single change made the difference for you?
That's a hard question to answer. We didn't really interact very much with any systems besides Medicare for the care for my mom. Her care was paid for privately with long-term care insurance. Today's insurance products are not the kind of policies that my mom had access to, that she got in the 90s, that she signed up for. Those policies don't really exist anymore. So the catastrophic protections that people even had on a minimal basis, the 3% of people who had long-term care insurance, even fewer have any sort of protections on that level now. So, employers are starting to offer hybrid policies. much the same way that they offer, extra life insurance or, even pet insurance that you could get through an employer, like a group rate. I've looked into some of those policies. The ones on the private market, they have more favorable terms for the amount of money that you get. So the employer products tend to be on a different kind of system where you're taking an advance on a death benefit to pay for the long-term care. And there are all sorts of other considerations. So these products aren't quite perfected yet. But it'd be great if the insurance industry and employers and, the financial system came up with a way to protect people in a way that happened on a mass scale, because the way insurance works, the more people who buy in, the cheaper it gets for everybody. And when only sick people or the families of people who have had Alzheimer's in the past who get scared and buy long-term care insurance because they know it's going to happen to them, if you only have sick people buying insurance, it gets too expensive. And so you need to get well people to buy insurance also. And the only way you're going to be able to do that is if you somehow lower the price. But you can't lower the price until you get the people to buy the policies. So something's got to break that cycle in order for people on a non-governmental level to, jump in there with the help of employers.
It sounds like with so many people becoming caregivers and so many employees who will be faced with making the same kind of decisions Amy had to and you had to, we will see employers recognizing this as a trend that needs to be addressed. Let's hope so anyway. But I would love, before we leave for our final, is to ask if family caregivers that are listening right now who might feel overwhelmed financially or scared right now because of what's happening to their finances, if there's one financial truth you want them to hear today. But before we get to that, is there anything that we might have missed that this conversation should have addressed that we might have missed that you'd like to add?
I think one thing that we need to really emphasize is the actual costs of care and how high they are now and how rapidly they have increased in the last few years. And that I'm talking about from even adult daycare, which is still a really, really great affordable cost. Many caregivers don't even know what adult daycare is, to, home care versus assisted living, skilled nursing care. The costs are far beyond what most Americans have any idea. If they haven't been thrust into this yet, they have no clue. And they think that everybody's prepared and they'll just go on Medicaid if they need to, but they don't even understand what that means and that not everyone qualifies for Medicaid. So I think, we need to really, really educate people and bring that home and make sure that they understand what these costs are going to be and make it possible for them to not just be overwhelmed and think, I can't do anything about it, so I'm not going to think about it. Give them tools to think, to plan, to educate themselves on the services that will be available and the benefits that may be available. And, just do this planning and make it more of a common conversation and help. That's why I talk about this. That's why I shared. It's not fun to talk about going through bankruptcy. It is humiliating and stressful and it's horrible. It's a horrible experience. But I decided to be open about it because nobody talks about this. And every time I do, a caregiver comes to me and says, I've been through this too, and I never told anyone. Or I'm really struggling financially, but we don't want to talk about it. I moderate a Facebook group for AARP. We have over 25,000 family caregivers. And whenever I ask a financial question, I'm kind of shocked at the lower response that I get. I always think I'm going to get tons of people because I know they're struggling, but they are so hesitant to be open about it. So we need to normalize this conversation and say, we're all going to face this. And here's what the options are. Here's what we need to think about. Here's how we learn from my mistakes, learn from Beth's mistake, whatever, so that we can, that we can get through this somehow. And part of this, I want to reemphasize that the largest amount of spending that family caregivers do on caregiving costs is not medical expenses, it's household expenses. And so, because probably like me, their loved ones use their funds to pay for all that medical things. I mean, my thinking was, well, they can write that off on their taxes. So they should do that. And then I'm going to pay the other things. Well, that's, what benefits are there for that? What's going to help with that? Maybe mom's on Medicaid and that pays for caregivers to come in, but she still needs to pay her mortgage or her rent. She still needs to pay the heating bill. She needs to have, food. So those are some of the things that I think are really critical.
This is perfect timing because there are a lot of AAAs listening, and we are going to highlight some of the AAAs on our website who are focusing on financial security for family caregivers. They're creating toolkits, they're creating trainings, they're having workshops so that the family caregivers can attend and learn ahead of time before there's a crisis or a bankruptcy. Those who are experiencing strain and stress and financial challenges can attend and get that support we've been talking about. So if you are a family caregiver listening, contact your local area agency on aging. Every county has them, every state has them. Some are more active than others. And if you are a AAA, do look into which ones are working on these financial toolkits, and because they're going to make them available to other AAAs. We have a wonderful AAA in Wisconsin, and they're working on an employer, they call it a care kit, and they are training employers on how to recognize the family caregiving challenges their employers are going through and how to help support them. And we have another one in Boston who's putting together a financial care kit. So they're out there. Resources are out there. We might have to dig a little bit. And that's what this podcast wants to do, is to highlight the good work and make it more accessible for people to reach it.
I want to just stress that AARP also has a lot of free resources for employers. They have employer toolkits. They even have workshops they'll offer for employers. And, area agencies on aging can work with those tools and work with their local employers and partner and do some of that reach. Because it's like, don't reinvent the wheel. It's like you said,
Right,
what's another
right.
AAA doing? What does AARP offer? What does
Yes.
New Extension Services offer? They do a lot of financial outreach. So how can we work with tools that are already available and reach more people?
Amy, I want to give a shout out to AARP because they were one of the first organizations that put together a financial toolkit for family caregivers. And I, for the last 7 years, have been working with family caregivers of individuals with memory impairment. And I searched high and low 6-7 years ago for resources. And I still to this day recommend AARP's financial workbook for family caregivers. And AARP was one of the very first to dig in and start addressing some of these issues with family caregivers, as well as the USC Family Caregiver Resource Center, two very strong advocates for family caregivers, but wonderful resources. So if you are listening, please visit those websites. And as Amy said, why reinvent the wheel? They are there, and they're there for you, and they're there to help and support you. So I think that we're pretty much winds it up, except I would love to hear Beth's final thoughts as well on that question, if you have anything you'd like to add.
Yeah, I would just say that what I found in working on my mom's care and on this book is that there is a solution for almost everything. Some of them are more painful than others, and some of them take longer or are more expensive, but there is a way to the end of every one of the financial issues that people tend to face with caregiving. There are things that you can do to make it easier for yourself and for your loved ones. So my job is to try to alert people to those things and so that they can do them before things get bad. But there is a way through to the end of every situation.
That's a great note to end on. I think so many people feel that there's a right decision and a wrong decision. And if we make the right decision, we'll feel really good. And if we make the wrong decision, we'll not. And the reality is there's just a lot of hard decisions. And what's right for one person's family might not be right for the other. And making those decisions is one of the burdens that family caregivers carry. And it might not feel good, but there is support for you. And like Beth says, this is not a forever situation. So get help and reach out to your AAAs and to your professional resources around you. Learn what your rights are, what your resources are available to you. Amy's book is available. We're going to link it on our show notes, as well as her Caregiver Facebook conversation, which is wonderful. And Beth's book, My Mother's Money, also we will link to in the show notes. And there are some wonderful resources in both. And I hope that you explore them and keep on listening, because we will keep breaking down the economics of care one conversation at a time. So thank you to our expert guests, Amy Goyer and Beth Pinsker, for your time, your expertise, and your passion about this topic and for helping caregivers. We really appreciate your time and expertise.
Thanks for having us.
Thank you. Bye-bye.
Caregiving journeys are rarely straightforward, and the lessons learned along the way can be invaluable to others facing similar challenges. Our thanks to Amy Goyer, caregiving expert with AARP, and Beth Pinsker, award-winning financial journalist, for sharing their personal experiences and insights on the financial and emotional realities of caregiving. These conversations help shine a light on what caregivers truly face and how we can better support them. Join us for more discussions on caregiving on the Care Economy podcast, and we'll keep making sense of the economics of family caregiving, one conversation at a time. The Care Economy podcast was made possible by the University of Southern California's Center for Advancing Family Caregiver Financial and Workplace Security, with funding from an Administration for Community Living grant. For more information about our guests, including links to resources, tools, and any references mentioned in today's discussion, visit our show notes or our website, and find this episode on YouTube or wherever you find your podcasts. We want to remind everyone that the views and opinions expressed in this program are those of the speaker and do not necessarily reflect the views or positions of the University of Southern California, the Administration for Community Living, or any entities they represent. And finally, to our audience, thank you for listening and for being part of the effort to strengthen the systems that support family caregivers.